What's up? My name is Melissa, and this is Wild on glasshouseradio.com, part of the Howard University Radio Network. Hey guys, welcome back to another episode of Wild, and today's guest is very, very special. I have Dr. Patricia Davidson here. Dr. Patricia Davidson is a medical internist and cardiologist who has a private practice in Washington, D.C. Dr. Davidson attended the University of Michigan, receiving a BS degree in psychology in 1972, and a master's degree in chemistry from Atlanta University in 1974. She graduated as the third woman of color in 100 years from the University of Louisville Medical School in 1978. Dr. Davidson is a diplomat of the American Board of Internal Medicine and a fellow of the American College of Physicians. Dr. Davidson served on the faculty of the University of Maryland Medical School as an assistant professor in the Division of Hypertension and Cardiology from 1985 and 1988. Dr. Davidson has been a practicing doctor for over 42 years. She was also an instructor of medicine at Howard University Medical School from 1982 to 1983. She served as a master faculty member of the Women and Heart Disease for the American Medical Women Association. I had to add that information onto it. I couldn't forget that she is a bison. No further ado, here goes my guest, Dr. Patricia Davidson. Hi, doctor.
How are you?
I'm doing wonderful. I'm glad that you are sitting down speaking to me today. So, you just are living history. You know this, right?
Not quite, but...
No, you have just seen so much, done so much.
Oh, yes, I've seen much.
And just, you're a disruptor. I consider you a disruptor, and I consider you a person breaking barriers all the time. That is what is the concept of wild. Wild is people who go against the norm and just kind of go do things on their own terms and really don't care what people have to say. I'm going to do it how I want to do it. And I think you're a representation of that. So we know that you was one of the first Black women of doctors coming into medical school, but how did you even enter STEM? Because STEM is not something that women, and particularly women of color, even gets into.
Well, it was during the 60s and 70s when we were basically disrupting the whole country, and we were trying to decide what we wanted to do with our lives. Most people figured social work and things like that, but that basically you were just part of a system that you would end up not really being pleased with. So we decided at that time that we needed to have careers in which we could have control of our lives and the things that we did in our community and contribute significantly more to our community. My sister, actually, who's older than me, was actually getting a master's in social work at the time, and she decided to do agriculture and start all over, having to take all the preliminary courses. I went to Tuskegee and did that. And then I decided I would do medicine. And I had to start all over and take the pre-med courses. And that's why I had to go to graduate school, because I didn't finish my pre-med courses in time to actually apply for medical school. And then I went on and got a master's degree in chemistry and then applied after that. So it was basically a decision for us to decide that we wanted to have careers in which we could have better control of the things that we wanted to do for our community.
No. So it was basically, with a lot of common theme that a lot of our wild guests have, is that a lot of them wanted to help their community. That's what chose them to become wild and really allow them to really get into their purpose. So basically you're saying that. So can you describe your experience being almost like the only Black woman during your time at medical school?
It was horrendous. I always say, at the time we didn't know what PTSD was, but after we found out what PTSD was, I realized that I had PTSD when I left. It was, they made it as cruel. They were the cruelest and most evil people that I had ever met. Well, that doesn't mean that they're the cruelest and most evil in the world. I was just fortunate enough not to meet those kinds of people before. So my life had been much more sheltered around people that I chose to be around, and positive experiences in university. And then, because I went to school during the 60s and 70s.
Of course, civil rights movement.
That was a wonderful time to be in Michigan at that time because it was a very radical school. And then I came down to Atlanta and the same kind of thing. So then I had to go to this southern, very racist in school, which was forced to, everybody was forced at that time to bring in black students because they were going to get federal money. So they brought us in and basically made us pay a dear price for it. And so it was quite an experience. And to this day, I cannot go back to the state of Kentucky. I can sit in a room with somebody from Kentucky now, which I couldn't do for several decades, but I couldn't even say the word Kentucky. And I always try to tell people that the lockers you all have as women came at a severe price because there were no lockers for women.
Oh.
So the first every episode of my life involved a locker room brawl. So
you actually was fighting people?
No,
Okay.
no, not physically fighting them, but
okay.
But the first locker room I needed was when I was doing you kind of do a preceptorship when you're a freshman. You hang around with a doctor, and he was a OBGYN.
Okay.
And so he says, we have a baby to deliver. So we run to this Catholic hospital. He said, I'll let you deliver your first baby. And I'm all excited. And I run in there. So I asked the nun, so where's the locker room so I can change into my scrubs? Says, well, it's up at the convent, 3 blocks up and 2 blocks over. And I said, so where am I supposed to change my clothes? Oh, there's no place really for you to change your clothes. I said, well, what is this? And it was a broom closet. So I went in the broom closet, hung my clothes up on a broom, and I came out to deliver my first baby. So then when I was doing surgery, everything for the surgeons were in the men's locker room. The dictaphones, the lounge, everything.
Yes.
So I had to literally stand outside the men's locker room, waiting for them to come out so that while they're all in there smooching with the people who were going to give them their grades, and then I would walk with them to the operating rooms. I had no place to put my clothes. So I had to use a lot of bathrooms, a lot of broomsticks. I learned how to change my clothes into a scrub suit in 60 seconds or less.
Wow.
And get my clothes back on in 60 seconds or less.
Wow.
And I also learned how to do it without dropping anything on the ground in a dirty bathroom. So that was my second issue. So then when I actually came to Howard to do postgraduate work, again, everything was in the men's locker room. So the women were very bold. So we used to just barge into the men's locker room to get the scrub suits. And we used to say, women come in. And the men would go racing towards whatever they could find, and we would just grab our scrub suits and walk out, right? And then that was fine. So then I did cardiology, and the men changed within our office space,
right?
And I was supposed to change in the bathroom. So one day I decided I wasn't going to do that. So I sat there while one of the men was changing, and I had my back to him, and I was reading my book, and Bromwell's cardiology book, and then the men came in at that time, and here he is in his underwear with a woman with his back to him, not the least bit interested. That horrified him. So they all decided that now they would all leave the room, and I had to change, and I would leave the room if they had to change. So then after I finished cardiology, I get my privileges to do cardiac catheterizations at the hospital center. My partner stood outside the men's lounge, was the doctor's lounge, for me to change. Again, I could do it in 60 seconds or less. And then the men complained, so I couldn't change in the doctor's lounge. So they had to give me a special place to change. and so then decades passed. So eventually all the hospitals went through renovations, and then of course, with the renovations that took place, then women got locker rooms, and then they stopped with the men being, the doctors being separate from technicians. So it was all one man and women. So then decades later, I walked into one of the hospitals, Providence, and they had a new cath lab, and there was only one place for everybody to change, all the radiologists, everybody.
Yes.
So I walked in the room, and one of this older cardiologists said, oh, let me get out the room so you can change, Pat. And I stopped for a minute, and I said, that took 40 years to take place?
It was 40 years?
For a man to just see me and say, oh, let me get out your way so you can change your clothes?
Wow.
I was like, it took 40 years.
40 years? That's wow.
For that to happen. And I was like, I just stood there in a state of shock that I didn't have to fight for this space. And it was that way all through everything. And so, like, say now all the things that you all get that you take for granted, like even at Providence, the women had the doctors in private practice had to fight just to use the the bathroom within the doctor's lounge because they thought it should remain a male doctor's lounge. So I mean, so it's just always this this fight with the men because we are taking up their space. And so now that of course that's illegal now. So all these things that you all get, you don't realize that we had to go through. I mean, we would go through interviews and they would ask us if we have PMS.
What? Hold up. Now that would be called sexual assault. Are you serious?
They say, do you have PMS? It means you're going to be out every month.
Wow.
And you're like, so they ask you about your menstrual cycle when you're in a professional interview. And so the key is to not cry.
Okay.
I learned that we had a whole thing at the University of Michigan for pre-med students, and then they would take us through these interviews and all that. And the first time I went to one of those interviews, I started to cry. So that after that, I understood that this is part of the tactic. And whatever women could stand up and not cry, and put their hands on their hips and fight back, and say something smart back, were the people who got the positions. Okay. The women who teared up were like, oh, get her out of here. So they asked you have PMS. I said, no, I don't have PMS. It's none of your damn business. And then you were like, and they would say, okay, she's okay.
No, so basically you had to be radical. You had to just stand up to the boys.
And then you had to hide your pregnancies.
Okay, yes. I remember.
Oh, that was just not acceptable.
Can you explain that? Because I know you did that.
You have to, so what you do is if you can figure out when you ovulate. Okay. You have a little wheel that you get in OB. So you figure out when you ovulate. So you figure out. So you end up getting pregnant during the end of one year and the beginning of the other. So you can do 2 holidays back to back. So it should give you 8 weeks off, right? Yes. So I did all that, and I hid my pregnancy, walked around with a book, and then they made this poor medical student come up to me because I was drinking a lot of milk and yogurt and he said, she can't be pregnant. There's no way she would get pregnant. And so everybody said, and the women would say, she's not pregnant. I sleep in the same room with her. She's not pregnant. So finally, they made this poor medical student come up to me at Howard, and he said, Dr. Davidson, they're going to flunk me if I don't ask you this question. I said, what's the question? Are you pregnant? He was like, come over.
And you had this.
I said, you tell them that their piss poor excuse for clinicians, I'm 7 months pregnant, okay? No. And then they did horrible things like they put all the pregnant women on the same team. Oh. Which meant that you have to stand up for long periods of time. Yes. To do rounds. And they put us on the same team as the chairman of medicine, Dr. John Townsend, who used to make like 4-hour rounds, right? Which means we all would have passed out. Yes. So I went up to him and I said, we're going to have chairs. So the nurses gave us the rolling chairs. So we went from one room to another so we wouldn't pass out during rounds. Yes. Because all your blood pools down into the pelvic area for the baby. And if you stand too long as a pregnant woman, you're going to pass out. Right. You see, so all that kind of stuff. So they try. So all during the thing, they're like messing with you to say that this is their space, and so you spend your life fighting those things. And so now it's acceptable. In fact, there's a feminization of medicine because men don't want to be doctors anymore because it takes too much money and time. So they said let the women have it. So that's why there's more women now going into medicine.
But still, though, women would not have women of color. And women, period, would not have what they have now if it wasn't for you and your cohort at the time for breaking the doors.
Right, we broke the doors down, but now they don't want the men don't want the door anymore because medicine has changed so much. Where you have to actually be employed by the men who normally would have been doctors. Now they control what you do because you have to belong to the MedStars and the Inovas and the Marylands and the Hopkins and all that. They control in this area. They control all the space.
So it's still a system, but it's just different.
But now they'll be able to pay women less, and they're going to be employees, and that's something that women have to start paying attention to, because men don't want these jobs anymore. Well, black men are not in college anymore, so they're not going to medical school. Right. White men don't want these jobs anymore. They'd rather control the medical system and not be in the medical system.
So it seems like even once women, particularly black women, get somewhere, we have to go ahead and put our fight boots back up, our gloves back on, because it just seems like we have to keep it.
Because it's going to be low pay and lots of work. So we have to make sure that when the new medical system is put in place, which it eventually has to evolve into, that it's not just about giving a whole bunch of women a whole bunch of low pay and a whole lot of work.
Right. So how does that deal with just black women being compensated for what they do for a living, and then also health insurance?
Well, health insurance is going to totally change.
Okay.
You don't know what it's going to change to, but it can't stay the same.
Right.
Because we've been shown the Affordable Care Act.
Yes.
Where somebody has actually agreed that people need insurance, and that's the first time we've ever actually accepted that as a nation. So we don't know what it's going to become. But I would suspect it's going to become something where people are all employed, and since it's going to be women, and then it's going to be a situation where women are going to be low paid. So we have to make sure that that doesn't happen, and we don't know what it's going to become.
Wow. So what would you describe the state of Black women's health right now?
Well, the state of all Black people is in a terrible state. That's primarily because we haven't had health insurance. And it's also because we have not spent enough time doing preventative health.
Is it because of our past? Because of the history with, in the past, we were used as guinea pigs for being lab rats for Black bodies for medical. So
no, it's just that the stress that we're under, the racism, has caused us to have unhealthy lifestyles so we're not paying enough attention. Right now I'm seeing a lot of new patients because an awful lot of doctors are leaving medicine. And these patients know nothing about cholesterol, even though they have heart disease. Wow. And so I asked the question, I said that in the 10, 20 years that you've had heart disease, did you even bother to Google heart disease? And so they don't even understand that it came from clogged arteries from their cholesterol.
Wow.
And so they don't know their cholesterol. So we spent decades trying to say, know your numbers, and you should know your cholesterol number, that you should know that the bad cholesterol is supposed to be under 100. It should be under 70. If you have any disease in any of your arteries, you should know that your blood pressure should be 120 over 80 or less. You should know that your A1C, which is 4 months of average blood sugar, should be 5.6. And that means that your sugars are running around 100 or a little bit more after you eat. You should know that your weight should be a body mass index of 25, or else you end up dying from your weight. You're going to have higher heart attacks, strokes, diabetes, hypertension, and cancers.
Right. And
so all these are risk factors that we, as a people, are not paying attention to. And so we get the worst food, and we're not paying attention. We consider eating healthy to be deprivation. And that's what we have to stop thinking about.
So how do we start changing the conversation? Of course, we're changing the conversation today because I'm talking to you, but how do we start changing the conversation in our community?
Well, it has to be a national conversation. It's a very difficult conversation. It has to be a national conversation that everybody has to deal with. We should all be, you hear all the talk about walking, and if you walk 30 minutes a day, you get a 50% reduction in heart attack, stroke, and cancer, and all those are real things. And I always, when I do my lectures to the lay community, I always try to say that the healthiest people in America are Asian women.
Okay, explain, please.
Because there are 3 things that if you do, you will prevent 80% of the causes of death.
Tell them, these are gems. People need to know this right now.
It's stay thin.
Stay thin.
Not smoke.
Not smoke.
And walk.
And walk. Okay.
That's all you have to do.
Those seem pretty 3.
Now, Asian women, I don't know about their walking, but they don't smoke and they stay thin. Their men smoke, so they've lost that advantage.
Yes.
So the healthiest people in America are Asian women, just because they stay thin and they don't smoke, and they may or may not walk. I don't know. Okay. So when you look at everybody else, that's not the case.
Right.
And so as a result, when one risk factor comes up, then they just keep adding it on and adding it on, because one risk factor leads to another, leads to another, leads to another. And so that's very, very important. And so that's the start of it. And so now we know with COVID that people who are overweight have a worse outcome. People with diabetes, people with hypertension have a worse outcome. We know that if you're vitamin D deficient, you have a worse outcome, and people with darker skin don't absorb sunlight. People who live in places where there's winter, like we do, have poor vitamin D levels. So that community has a whole cohort of people with low vitamin D levels. I measure all my patients' vitamin D levels, so that makes you more prone to get COVID and have a poorer outcome. So all these are the kinds of things that we have to look at that exist in our community. But when we talk about healthy lifestyle, it's very difficult to have a healthy lifestyle if you're under so much stress, and racism leads to stress, which leads to high blood pressure, which leads to poor eating habits and all that, and emotional eating and things like that. So we have to accept the fact that all of these play a role. And so if we just walked, stayed thin, and didn't smoke, we would not end up with the diabetes, the hypertension, the heart disease, the stroke, and most of the cancers.
Wow. So it could just really be that simple.
It is that simple.
So how do we, like, so I asked this before, but let's go more in depth. How do we just change the whole paradigm, a lifestyle of change? Because it's really just a change of paradigm.
It starts with the food that we eat.
Okay.
The food industry has made us addicted to foods that are not healthy, which drive us to the diabetes epidemic we have right now. And that's carbohydrates.
Yes.
All right. So we have to start getting away from the potato chips and the popcorn and all of the stuff, that the French fries, all that stuff that is basically is wonderful and is comforting and all that type of thing, but it leads us to diabetes. So I always tell people the only carbohydrates you should be eating are green vegetables, and get rid of all of the cereal, rice, pasta, bread, and the potatoes and the juice and the fruit and all that, and focus more on the fruit that's grown in the northern part of the country, apples and blueberries, because the tropical fruit, which is grown in the sun, has way more sugar. So we have to start getting rid of all that sugar out of our diet. Sugar is addicting.
Yes.
And as a result, we end up eating more. And they want us, I don't know if you've seen the commercials, which always show people going crazy over something. You can't have just one, and all that type of thing. And that's because they make it addicting. It's called the bliss point. They actually hire people to taste things till it gets to what they call the bliss point, where you can't have just one. And so the food industry has indoctrinated us to overeat, to eat foods that we should not be eating, which are terribly delicious and comforting. So we have to get away from that. Eating too many animals. We know that has a high increase in cancer rates and clogs our arteries. So we have to start going more plant-based. We don't have to be completely plant-based, but we have to start eating the foods that are low in cholesterol. Like I always say, that the fish that swim and the animals that fly. So if it walks on the land or on the bottom of the ocean, it's very high in cholesterol.
Right.
If it flies or it swims, it's lower in cholesterol. So you want the animals that are lowest in cholesterol without the skin, and have some meatless days where you have beans instead, plant-based diet instead, so that you want to have your LDL cholesterol at least under 100, and that's the bad cholesterol, and ideally under 70, which means you're highly unlikely to have any plaque in your arteries. So you're trying not to grow plaque in your arteries from high cholesterol foods.
No, and you know what? That speaks on just so much, because when most people say, well, I'm only going to do seafood, they automatically think I can eat all the crabs and shrimp.
No, because shellfish is very high in cholesterol.
And so you're saying that you're being pescatarian. I think I'm saying it right, pescatarian?
Okay, but you want the fish to swim.
Yes, the fish to swim. It doesn't mean you just eat crab legs all the time. So basically, the biggest drug right now is food. It's not...
Food, and I always like to compare, and not only just food, but white food.
Okay, so can you elaborate for the people who don't understand?
All the food that has been made white, the white potatoes, the white rice, all the nutrients have been taken out of it. The white flour, all of that, nutrients have been removed, and you end up with just sugar.
Right.
So if you're going to eat the grains, it must be
brown.
It must be brown. But ideally, even then, there's too much sugar in that. If you're overweight or your sugar is up, you want to go to things like quinoa, which is a high protein grain that comes from South America.
Right.
So that would be a better grain than all that, if you're overweight or if you have high sugar. But if you have to eat the grains, then you need to make sure it's brown rice, and you need to make sure it's 100% whole grain bread, and ideally Ezekiel bread, which is found in the freezer section, after the Bible verse from Ezekiel, in which you have sprouted flour, which has a lower glycemic index, less sugar released into your system when you take it in. So your goal is to try to have as little of that in your system as possible, so that your sugar doesn't jump up. And that's how you maintain your weight, and that's how you stay away from a sugar addiction. And sugar is just as addicting as cocaine and crack and all of those other things, because it is just as hard to get off of, if not harder, because it's so socially acceptable.
Yes, and then also in our tradition and culture, that's how a lot of the times we gather around through food.
That's right. And most of it's going to be carbohydrate, because that's the cheapest, and that's what we produce the most of, and that's what's most comforting.
And then also, if we go back to a history standpoint of it, we were given the slaps, we were given the worst, we were given the what nobody else wanted.
And we produce the sugar and the salt that the slave masters forced us to produce, and now we're the slaves of the sugar and the salt.
Yep. It's just so simple. We have to take a quick commercial break, but we'll be back with Dr. Davidson on everything about health, Black women's health, and just all things wild. Remember to check out Wild Theme Music playlist on Apple Music. Every wild person needs theme music. Each week, our guests create their own theme music playlist. Check it out on Apple Music playlist. Go to _wild, WILD, human, HUMAN, _IG page, and click the link tree for the playlist. This is Melissa on glasshouseradio.com, part of the Howard University's radio network, and this is Wild. We are back with Dr. Davidson. Dr. Davidson, what you do a lot. You know that, right? You kind of like a superhero. You kind of like, you're like a female superhero. Like before it was all famous and cute. Like you was like knocking people out. Like you was doing all that. So what is your theme music playlist to get in the zone? Like, what do you like to listen? Do you like to listen to jazz, hip hop, gospel? What's some of your favorite artists?
I just listen to PFW all the time. Whatever they have on is fine with me.
But what is your routine? You have to have a routine to get you in the zone because you're doing a lot.
No, I mean, I usually have jazz on, but like I said, I don't mind the old R&B, Motown time, which PFW plays on Saturdays and all that type of thing. So I just.
So you a gumbo. You like a little bit of everything it gets you in the zone. What will you tell women that have to do with hierarchy, patriarchy, and toxic masculinity? Because that's a lot, and you dealt with that.
Well, at least now it's illegal. My day it wasn't. It's difficult to say because, like I say, now it is illegal. It's not acceptable.
Right.
We have to be very careful that white women are not always our allies.
That's actually another question I would love to talk about.
And considering that their numbers who voted for Trump have increased, it's very sad to say that they have bred the fascists that exist in our country. And so they're not necessarily our allies. They are the ones who have benefited the most from the civil rights struggle. In terms of opening doors, they were the first to get in and have risen the fastest. So they're not our allies either. So, I mean, it's very difficult to say for somebody who ended up picking my own path and staying with in my own area. I probably could not have survived in a downtown in one of the federal buildings. And so how people do that to me is very difficult. And I really can't tell somebody how to do that because I could never pick that kind of role because I'm just not that kind of person who could have put up with that. And it is difficult. I guess you have to group together and try to figure out how you're going to do it. But then also pick careers where you don't have to spend your life under that kind of stress either. That's important too because it's extremely difficult to me to spend your life under stress with constant racism day in and day out.
And since you are a doctor and you could talk about how does racism affect health and stress?
Everything. It drives up the blood pressure. It causes you to have unhealthy eating habits. It actually affects the cells within our body, something called the platelet cell, which is the cell that causes the heart attacks and the strokes, causes the blood to clump, and we have a ruptured plaque. So we actually have a chemical reaction that takes place that constricts our arteries and drives up our blood pressure. And so all kinds of horrible chemicals take place in our body because when basically you have good chemicals and bad chemicals,
right,
and good hormones and good enzymes, and the bad ones are increased when we're under stress.
No, that makes so much sense. So when people try to argue that racism is not that bad or it's not a real thing, it's just
they know better.
They know better, but of course
it is, and we know that, and that's part of our mental illness, since we have such a high rate of mental illness in the Black community, and it's part of our unhealthy behavior. So we end up doing things that are pleasurable, like eating, and eating food that is pleasurable. So we end up being, we end up causing our diabetes and our clogged arteries and those kinds of things.
So with understanding racism in the climate of America, racism been really heavy. It's always been heavy, but sometimes it goes undercover and then comes back on top. But it's been very blatantly in our face. Plus, we're dealing with a pandemic. How do you feel like this has affected the whole entire medical world or medical viewpoint?
Well, I think that everything changed this year because of what we saw in Minnesota. Was it Minnesota? Minneapolis, Minnesota?
It was one of them, yes. It's been a few places.
One of the M's.
Yes.
Because of that changed the world.
Mm-hmm.
And it changed enough people to recognize and to at least use the words like systemic racism.
Yes.
It changed people's views of us.
Mm-hmm.
People found out what HBCUs were when they sit up and they say that we don't like education.
And we are graduates of HBCU.
And you're sitting here saying that they finally found out, oh, HBCUs are there because we wouldn't let them come to our schools. And so in fact, Howard Station recently had the Jubilee Singers story.
Mm-hmm.
And when you see those kind of stories and how hard it was for us to gain an education and still do it, no matter what, and how they burnt down all of the freedmen schools that they could find.
Mm-hmm.
And so there's all that history there. So people are now recognizing how they burnt all of our business communities. Why are we not good at business? Because they burnt all our business communities and we didn't have anybody to show us how to do business anymore. And so they're like, oh, Tulsa, oh,
Mm-hmm.
And so they're hearing about all of these things now. And so it's a different environment. We just have to keep that pressure on to make sure people understand that there's a whole history that comes behind some of our behavior if it is dysfunctional. And we just have to try to, again, keep trying to find a path for ourselves. And again, you probably need to try to find paths that don't necessarily involve being in an environment where you have to be the underling to a whole bunch of oppressive people. Because to me, that would be a very difficult position to be in. So, and you have enough opportunities at your HBCUs to find careers that will lead you into a more independent path.
Mm-hmm. No, that just makes sense. I totally agree. As being an HBCU graduate, this will be my second time soon with an HBCU graduate, that you just have to find different paths. So you are a Bison, I'm a Bison, and now our vice president is soon to be a Bison. HU Women Lead. Can you speak about that, HU Women leading? Because it's just something about us. We kind of like know just how to take over. We kind of take over without taking over.
I think some of the Spelman would say Spelman will lead too, right?
Yes. Let's just say all HBCU women, they know how to take a place over. They know how to handle themselves.
In fact, there's a very nice sweatshirt I heard about from one of my patients who's a Spelman alum that said there's a sweatshirt out that says, what happens when you piss off a Spelman woman? She'll turn you blue. And there's a picture of a wand. Mm-hmm. So I mean, I think that gives you the courage and it just gives you the courage to be a leader.
So you could speak about going to a PWI, because you had for a couple of your degrees for medical, and then you could talk about the HBCU experience. What's the difference do you feel, the biggest difference that people don't understand why HBCU is so important? And
I think it gives people confidence. First of all, most of the STEM degrees of African Americans come from HBCUs because that's where they gain their confidence. If they go to these other schools, they will lose their confidence, and so that's important. And it's about confidence and feeling that you can be a leader.
No, I totally agree with that. And why are we not giving back to our HBCUs as a community if they play such a vital, important role in our society for the Black community?
Well, I think they will, and that's why there's been so many millions of dollars, hundreds of millions of dollars just bestowed upon HBCUs, and they will not be disappearing because of that, because people now recognize the role that they play. And when they saw those beautiful pictures that was on everybody's TV screen of all the Howard graduates, I mean, that was just so profound. Because people say, because when you think about it, what are the law schools that have made it to the Supreme Court? Yale, Princeton, Harvard, and Howard. And no other school has made it to the Supreme Court. No. Okay?
Now the White House.
You see, so it's like, so that's significant, and people saw that. And they saw the worth, and so that when you have schools like in Maryland who were supposed to be part of the Maryland system, but they were being shortchanged the money.
Yes, I interviewed Dr. Richardson about that. Yes, I remember.
You see?
Yes.
And so all those schools won the lawsuit, but now they claim they don't have the money, but they'll find it.
Yes.
And so I think that, and with all the philanthropists now giving hundreds of millions of dollars to HBCUs, people see the value, see that the struggle that we had, their history, and why we had an HBCU in the first place, and that Black people do value education, to the point that we put our lives on the line for it.
No.
And so they won't disappear. And so as the other schools become uncomfortable, then HBCUs are the place where you have a comfortable, environment, and I think that they will flourish now. And then when they talk about reparations, that the best reparations are not about giving a check to somebody who can trace the great-great-great-grandmother back to slavery. It's about, propping up HBCUs, and everybody has said that. Start propping up the HBCUs.
No, that's true. Reparations will be able to help so much with HBCUs, giving money to the community, making sure our a lot of these buildings are old. Yeah,
just educate people.
Yes, very much so. No, so I wanted to kind of move on. So on Twitter and Instagram, there was a conversation about Black women experience their journey through doctors. Of course, sadly, predominantly white doctors, how their pain was not being taken seriously. How do Black women can go about just being taken seriously with doctors? Because we're not at sometimes.
Well, I think as a whole lot of people are not taken seriously.
Okay.
All right. There's many immigrant doctors who don't understand the culture. Mm-hmm. Some actually come from a culture where there's a class of people called untouchables. Okay.
Define, please.
Well, there's a class of people called untouchables in the Hindu religion.
Okay.
And so, if you're in front of a doctor who was brought up in a society that perceives of somebody as untouchable, who's within their own race, what do they think? Where do we fall? We're below the untouchables, right? So that in itself is about, you're coming from societies where you do not question people of a certain class. So how do you even question the doctor who comes from a society, and that could even include African societies where you do not question authority. So it's extremely difficult. You basically you can't just go anywhere to find a doctor. You basically, there's enough institutions around there, federally funded clinics, who know that they're treating people who haven't been to doctors before. So you have to pick where you're going for medical care, and you can change. It's easy to change. We have a large proportion of people in the district are allowed to get Medicaid because we've had Medicaid expansion since Marion Barry's time.
Yes.
We've had universal health care since Marion Barry.
Yes.
He started universal health care.
Yes.
All right? The rest of the country just caught up.
Right, no.
And we will still have universal health care if the Affordable Care Act is not dead.
Right.
All right? Because people have always been able to get medical assistance, not just pregnant women and children. We've always had the expansion to anyone who didn't have a job and insurance. And so there are an array of doctors. If the doctor that you're seeing doesn't communicate with you well, you find other doctors. And there's plenty here. There's clinics here, and you make sure that you're in a setting that of a doctor who can understand what's going on. But most importantly, you have to be ready to change your lifestyle to prevent disease and to participate in your care. You always participate in your care. You don't let anybody draw blood and then not tell you the results. What is your blood pressure? What is your cholesterol? What is your sugar?
So you have to be an advocate for yourself.
You have to be an advocate for yourself. You have to participate in your care. Medicine is not a spectator sport. I keep telling people that. You're supposed to participate in your care. So when I ask a new patient, what are their numbers? They don't even know what their numbers are.
That's a problem.
They've never bothered to ask, or they say that I had surgery, but I don't know what was done. They don't know the name of the operation. So you write down the name of the operation. Yes, it may be 10 syllable words, but write it down so I keep it in my wallet, so the next doctor I see who will explain it to me, or I can Google it. You can Google everything now.
Yes, we have Google University.
So you can, you just look up.
So there's no reason to be, I would say, ignorant about your health. There's no absolutely reason.
And every single office in the United States has anything to do with health. The NIH, the Health and Human Services, CDC, all those offices. They all have what everybody's supposed to get from day one of their life. At what point are you supposed to get whatever you're supposed to get? What tests you're supposed to get, what cancer prevention screening you're supposed to get, what preventative things you're supposed to get. And so all of that is online. So you should know that you're supposed to get a colonoscopy between 45 and 50 if you're African American. You should know you're supposed to be getting a mammogram by 40. You should know that you should be getting a PSA at some point in time. You should know you should be getting your blood pressure and your cholesterol and your sugar checked. So these are things that everybody needs to know. And again, as I said, that there's 3 things that you can do to prevent 80% of the problems that you're going to die from.
And for the people in the back who was not paying attention, Doc, where are they?
Stay thin.
Stay thin.
Don't smoke.
Don't smoke and walk. All right. So people have been really freaking out about this vaccine. Do you think this vaccine is great, or does it need to be tested more? Like, should Black people take this vaccine?
Oh, it's not a question of who should take it. All right. Only one vaccine is being published.
Okay.
That's important.
Yes.
Oxford is publishing their data today.
Okay.
The others, the lawyers were telling us the numbers so that they could drive up their stocks. Okay? So that's important.
Yes, that's very important. The information is very important.
There's going to be 3 vaccines within December.
Okay.
And the one in Britain is probably going to be released immediately because they're going to release it worldwide. That's the cheapest, and it doesn't have to be frozen. The others are going to be more cumbersome. We should be a part of it, and it's not a situation where we're the only people being a part of it. Clearly, the white population has been the largest population within the trials, even though they have sought to get everybody else in the trial. You need to know that it's African American woman who's one of the lead people in the vaccine at the NIH. And I heard that when I read I actually saw her on the screen and didn't bother to put her name or her title on it. But when they had an article about the president of UMBC, Baltimore campus,
yes,
Dr. Herbalski and his wife are part of the trial because one of their students, a Meyerhoff scholar, is one of the lead investigators on the NIH vaccine. And so nobody's publicizing her, even though she gets on TV, her name's
and of course it goes back to what how your journey was. Yes.
But he actually stated that she was one of the lead, and that's why he's participating, because it's one of his students that's leading this. So he says he's definitely going to be there, and he's going to make sure that he supports her. So that's important. So it's not like we're the only people being tested. We're not.
No. So we should change our conversation with vaccines.
Well, I mean, it's a matter of do you want to be the first? Maybe not.
Yes.
I think the people who are working in meatpacking places, people who are working in supermarkets, people who are in nursing homes, people in the hospitals, all those people who are going to be in contact with COVID patients should be the first to get the vaccines, and then the rest of the people can get the vaccines. Right.
So you understand why some people are a little hesitant.
Oh,
but
yeah, everybody's hesitant.
Of course, but with that, there's room for this vaccine to actually work and get rid of COVID. Do you think COVID gonna?
Well, it's not. I think it's gonna be like the flu.
Okay.
I think it's gonna mutate.
All right.
I don't think you're gonna have long-term immunity, and we don't know that because this is the first time we've ever released something before long-term studies.
Yes.
We usually wait 5, 6, or 8 years to see what's going to happen with the vaccine. So we do not know whether we know that your antibodies don't stay around forever.
Right.
And we know that the number of people have gotten COVID more than once.
Yes.
So therefore, there's an antibody problem right there. It's not a long-term, just like the flu. And it mutates. So every year you get a flu shot, but you get a flu shot of the last 3 flus that were prevalent last year, and then there's always a new mutation, and everybody gets really sick. So we have to find that out. So we're all going to be finding out together. It's not just us, so we don't have to be feared that we're being targeted as guinea pigs because we would be the least likely to be offered the vaccine as opposed to people rushing into our community. Right. So we don't have to fear that kind of thing. Which one's going to be the best we have to, you can decide whether you want to be first in line or you want to be down the road a couple of months.
So we're getting ready to close up this interview. Doc, what would you tell someone a Black woman who's looking at getting ready, I want to get into medical, but it's not the journey that you went through because we're in new times. It's a lot better, you say. What would your advice to tell them about what they're getting themselves into?
Well, they don't know what they're getting into. The medical system is undefined right now and is going through evolution. So you do not know what you're going to end up in. Are you going to be an employee of a large conglomeration telling you when you have to come to work, how long you have to spend with a patient, and where you're supposed to go, which clinic, which location, which city, which state. And you're going to have a big debt and not make anywhere near the money to pay it.
Wow.
So that has to be thought about first.
Mm-hmm.
You will not have autonomy.
Mm-hmm.
And so this is one of these careers, and there's a whole host of careers that are like this, in which people went into them thinking that they could rise from one class into another.
Mm-hmm. Medicine
was one, pharmacy was another, and dentistry was another. Dentistry still may be that way now, but pharmacy, you have to go, you spend 5 years in a very difficult curriculum
Mm-hmm.
at the undergrad level. It's not a 4-year degree, it's a 5-year degree,
Right.
to come out and have to work for Walmart. Who tells you that you have to work on Christmas Day? Not to have your own pharmacy. You see, so all of that is changing, and people have to decide whether they want that level of extreme education in order to have to work for somebody else.
Mm-hmm.
So we don't know what it is. So if you are willing, if you're doing it for the love of it,
Mm-hmm.
Yes, but don't expect that you're going to be making a lot of money. I wouldn't do it if I was going to end up in a huge amount of debt.
Mm-hmm.
There's a number of ways to get rid of your debt in terms of where you practice, but they don't allow you to pick where you practice, so it will be on an Indian reservation. NIH supposedly may still have internships or something that you can help do your payback by doing research at the NIH for a couple of years. The military is another way if you want to go that way. So I'm just saying that it is changing, and you have to accept that fact so you don't come out angry
Mm-hmm.
because you didn't get to, it wasn't what you thought you wanted to be. But of course, there's a tremendous amount of things that you can do with medicine in the future, and you have to basically do it for the love of it and not for the independence nor the money.
No, that's a good thing, because most people think I'm becoming a doctor, so I'm going to make a lot of money, I'm going to be this rich doctor, and especially black people, we when we think about trying to get out of our poverty, we automatically think become a lawyer or a doctor.
And lawyer is definitely one of those fields you don't want to go into, because there's just overcrowded.
Yes.
So you don't go into that to make money.
Right. So you have to do this love for the passion, for the passion.
Correct.
Yes. I have one more question, because it just came up in my head before we get to the very, very last question, which is the Wild Award. Why is it so important for your doctors to look like you? Like, I know some people might say that, it doesn't matter, but I do feel like it plays a part.
Well, the data shows that you get a different kind of care.
You can't lie with data.
And that's been written up in a whole lot.
You can't lie with data.
So, so it does play a role, and like I said, but it doesn't mean that other people cannot do a good job too.
Of course.
But you just have to find those other people
that's going to listen to you and understand the cultural competence of where you're coming from. No, I get it. So now to the last question. So Doc, every guest on this show, we give them the Wild Award. So you give the Wild Award to somebody that has paved the way for you to get here. It's either someone you know, they could either be live or dead, or you don't have to know them. You could just admire them from afar. This person helped you, because we don't get nowhere by ourselves.
Dr. Galati.
Okay.
Dr. John Townsend.
Alrighty. Can you say what their profession was?
He was the chairman of medicine.
Okay.
Dr. Galati was psychiatry. I think she may have been chair at one point at Howard.
Mm-hmm.
Dr. Lester Henry.
Mm-hmm.
He was the chair of medicine at one time, and then the endocrine department chair. Those are people who played a role in helping me try to figure out what kind of person I wanted to be.
Mm-hmm. No, that's amazing. So thank you, Doc. Anything else you want to say to the people? Tell black men to come see you, black women to come see you, get their behind in office to be checked and healthy.
They need to know their numbers.
Know their numbers.
Blood pressure, cholesterol, and sugar, and the body mass index.
And then also, Doc gave the 3 keys to being healthy. Don't smoke. Wait, hold on. Let me make sure I remember them. Smoke. Stay thin.
Don't smoke.
Don't smoke. And walk. Those are the keys. All right, guys. Thank you for another episode of Wild. Thank you, Doc. It's been a pleasure talking to you. So once again, my name is Melissa, and you're listening to Wild, a part of the Howard University Radio Network. See you later. Peace.